Okay, welcome. And we are live. Thank you for joining us. And I am Sarah Merritt of Lifestream Health Center in Bowie, Maryland, where I'm an interventional pain specialist. I treat patients with acute and chronic pain. Primarily, we treat chronic pain in my practice, and we're striving to make pain management care caring, accessible, patient centric, and evidence based. And we do these lives as a service to the community and to our patients to try to bring greater awareness around chronic pain conditions, how people with chronic pain can live better. So I am blessed to have very many excellent physician colleagues who want to speak on such matters. And so one of those today is the lovely Dr. Isabelle Amigues. She is French, and you will enjoy her accent, and she will tell you her very compelling story about some of her own health journey. And I'm so pleased that she's here, Dr. Amigues. Welcome.
Thank you so much for having me. Hi, everyone. And thank you so much, Dr. Merritt, for having me. Such a
My
pleasure.
pleasure. So Dr. Amigues is a rheumatologist. Sometimes I refer patients to a rheumatologist, and literally this week, someone asked me as I'm making that referral, what is a rheumatologist?
Such a good question, right? I think if you ask the question to 40 rheumatologists in the room, you're going to get 40 different answers. Like rheumatology in France is different than rheumatology in the US, for example. Okay. But in general, my short answer is Dr. House without the attitude.
Dr. House without the attitude. Okay. So going to investigate, going to do all the testing. Yeah.
Yeah.
So and I know that you do injections. So if a patient needed like a joint injection, that could be something that you could do.
Exactly. So rheumatology is this really broad word to say that it used to be anything joint related. So in France, it's really anything joint related, including osteoarthritis, including back pain. So I did a lot of chronic back pain back in France. But in the US, it's really more inflammatory and so autoimmune. So it's someone with fever of unknown origin is still going to see a rheumatologist. Someone with joint pain, of course, is going to see the rheumatologist. But it's mostly patients with inflammatory arthritis that we are going to actually follow. So inflammatory arthritis of the back or of the joint. And so that's usually the main symptom, but there are other rheumatologic disorders that do not affect the joint. It's just that almost all of our disease can affect the joint. And so I think that's sort of why it became rheumatology. Anything that can affect the joint is seen by us. So lupus can affect the joint, autoinflammatory syndrome, gout, pseudo-gout, but, so many other ones. So I'm thinking Still's disease and fever of unknown origin, really, vasculitis and so on. And then osteoporosis because it's the bone. But, so I think it's kind of a nebulous, it's a nebulous specialty in the sense of it's pretty broad, but at the same time, it's pretty small. But yeah.
There are only so many rheumatologists, right?
Yeah. And I think we are kind of the end point when people don't know. I think they send to infectious disease and they send to rheumatology when they don't know, because we love diagnosing patients. So when there's a doubt, we love that. This is, I love it personally.
Yeah. Investigating and digging deep. Yes.
Exactly.
Yeah. And I think the other thing for patients to know, to be a rheumatologist requires a full residency in internal medicine, which is like enough that you could do that and have that just be your specialty. And then you could do primary care or other things within the internal medicine specialty. That's like enough in and of itself. And then you go beyond that to add, the subspecialty knowledge. So that person who is your rheumatologist has that depth of knowledge in the, primary area and generally taking care of patients, diagnosing and treating diseases.
That is true. It's, I did so many studies at this point because I calculated one day, I was like, 17 years of studying. So, the training, it wasn't just studying, training that I lost count, but you're right. Yeah, it's 3 years of residency in internal medicine. And then I did 3 years of fellowship because I really like training, I guess.
Hmm.
But yeah, it's 2 to 3 years of training to become a rheumatologist after the residency. So that's like 5 years after med school.
Yeah.
Yeah.
So I think that, so in rheumatology, and you said this sort of already, but the conditions that a rheumatologist might treat particularly involve inflammation. Um, One question that I get, and that sometimes I have a hard time answering, there's a lot of talk about an anti-inflammatory diet and reducing your
Mhm.
inflammation. As a physician, I'm familiar with things like C-reactive protein and a sedimentation rate. These labs, right? So these are labs that the doctor might order to help understand your inflammation. And that's like one measure of inflammation.
Mhm.
Is that the measure rheumatologists are using these days? Are there other things? I'm interested to know.
Yeah, so that's such a good question. So let's talk about inflammation a little bit.
Hmm.
So there is inflammation and there is inflammation. There is the inflammation that your Western doctor is gonna be able to diagnose.
Okay.
I'm talking to your patients, right? And
Yeah.
that type of inflammation is pretty obvious. Either it's fever, or there's like elevated CRP, elevated ESR, or
Yeah.
like some other inflammatory
Yeah.
markers. And then the usually the symptoms are pretty obvious, right? Like it's
Hmm.
like severe joint pain that's worse in the morning. There's like 1 hour or more of morning stiffness. There's swelling of the joint, and this. I mean, I want to say like no one can miss that, right?
Hmm. Hmm.
Um, that's what we thought was inflammatory arthritis in the past, and then what's happening is that more and more, and we always should listen to our patients because they're giving us the clue. And
Hmm.
when you talk to patients, they will talk to you. Like I remember 20 years ago when patients were telling me about their diet, and I didn't know. And I was just like, well, if it's helping you, continue. But I didn't know the data about it. So I was like, I cannot tell you to stop eating this or that just because of there's no data. And now, 20
Hmm.
years later, there's data. So I think, there's like this anti-inflammatory diet, there's more and more data to show that it really helps inflammatory arthritis, and it probably helps not just inflammatory arthritis. So there's the big inflammatory conditions, and then you start learning about all of the pro-inflammatory diseases that are in our body, and that it goes a little bit deeper than rheumatology, but I'm very interested in that. I did a research on that as well when I was at Columbia University.
Hmm.
And just to give you a sense, just to understand this, right? So even patients with rheumatoid arthritis that don't have any cardiovascular disease, right? Like we don't know any heart failure of them or coronary artery disease, nothing, right? Like they are totally asymptomatic. When we looked at we did PET scan of their heart, we found that there was inflammation of their heart, and that some of that inflammation went and got better with treatment. And
Hmm.
so, then the question is, wow, so is there all of this inflammation that we're just not seeing? And so when a patient is saying, hey, I feel inflamed, I think we have to be like, okay, well, you feel inflamed, here are all the things that you can do. I don't think necessarily everything is immunosuppressive, right? Like it's not because you have inflammation that you should be immunosuppressed, which is when you have a rheumatologic disorder that's very inflammatory. That's where we are going, right? So if you have rheumatoid arthritis, we give you something to calm down your immune system. But I think it's really interesting, and I bring this in my own practice because there's more and more data about anti-inflammatory diet and techniques that we know actually decrease the marker of inflammations, and that help with healing. And so you can actually do things to help your own healing that are in addition to immunosuppressive therapy, or instead of immunosuppressive therapy if you don't have a severe inflammatory condition. So the CRP, the ESR,
Hmm.
those are like the main marker of inflammation, but really there's also the C3, the C4 that can be elevated. And then I believe that there's a lot more markers of inflammation. It's just that we don't do them in clinical practice because
Yeah.
they are not something that we're going to act upon in the sense of like, I mean, I do not personally wait for a CRP or ESR to be elevated to start treating my patients.
Okay.
So
If they
that
have that feeling, if they voice that they have a feeling of inflammation, that would be enough to
and
try these types
clinically,
of
right?
treatments.
I think the inflammatory markers are super interesting to get a sense of how your treatment is working. So that's
Mhm,
really important. It's sort of this other piece of information, right? You have what
mhm,
the patient is saying, how the patient is looking, and your clinical exam, because that's like so important. We are now having also ultrasound, like the joint ultrasound, which I
mhm,
personally love doing. And then there is also those inflammatory markers and what the patients are saying.
mhm. Very good. Yeah, and then the determination of the success of treatment probably is what you said, what the
Love
patient is
this.
saying, what the patient perceives, and is there a
Yeah.
difference? Yeah.
But it's a very interesting question that I think is starting to be it's being investigated. You know what I mean? Like
Mhm,
it's
mhm.
something that we didn't know. And I very often say this to some patients. They're like, why is it that I feel that my doctors are not listening to me, or they're, not taking me seriously? And I always tell
Yes.
them, look, doctors are trained a certain way, and we go by the science behind
Mhm.
everything. And the science, we are constantly learning something new, right? Like every year there's something new. I mean, every month or 2 days, really.
Yeah.
And so I think that it's just super empowering to explain now to the patient that, yeah, there are things that you can do to decrease the inflammation in your body.
Yes.
And it takes work, right?
Mhm.
Like, so meditation decreases the pain, decreases the inflammation. It actually improves your rheumatoid arthritis. I'm just giving an example of inflammatory arthritis. There are so
Yeah.
many, right?
But there's
Um,
science that really backs this
there
up, and it's
is,
not just,
yeah,
like, made up, or it's not just something
there
that's,
is,
in your
there
head, so to
is.
speak. Yeah.
Yeah, there is. And I think that that's even more empowering to say this, because then it's like, oh, you're not needing a drug to act, right? Like it's not like,
Yes.
oh, I'm going to cross my
Yes.
finger that this drug is acting.
Yes.
But it's really, oh, well, hold on, there's all of those things that I can do
Yes. If
and
you're
that
ready
are
to
going
take
to
control of your health, there are things.
exactly.
Yeah.
Yeah.
Yeah. Yeah, and I think that that can be, we have that conversation in my practice too, as far as that mind and body connection, and optimizing that to improve pain. And it doesn't mean that your pain is made up or in your head, but it does mean that there are things that you can do to optimize your own health. And some of it has to do with managing your mind.
Yeah. I want to share something with you, because
Mhm.
I believe in this. I used it for my own healing. But recently, not so long ago, I had forgotten about it because I wasn't, needing my like healing because I was okay. And then
Mhm.
I had a friend who gave me her cat for cat sitting, and I love cats, and but that cat is literally our baby. Like it's her baby,
Mhm.
and like a firstborn, right?
Yeah.
And the cat got lost outside, and I
Oh,
finally found the cat after an hour. And I was like, okay, we need to put her back into the bag to carry her back home, right?
okay.
And I did not take her. Like I don't know why. I just thought, oh, she looks so cool. She's playing with me, so I just took her in my arm. And the moment she saw the bag, she started like scratching and biting. And I was so scared of losing her that I pinned her down. And I was like, I am not letting you go. You can eat me if you want, but like, you're my
Oh,
friend's cat. I cannot lose you again, right?
it
So
sounds like you got an injury is where this is going.
yes, exactly. No, yeah, yeah, exactly. But like all the way to the injury, right? So
Yeah.
horrible, horrible bite, horrible scratch. Thank
Mm,
you for it. Um, and I go to the emergency room because I wasn't sure if I needed stitches or not, right?
mhm,
And the pain was pretty intense.
mhm.
And there was weight in the emergency room. So I had like, like all of this blood.
Dripping, yeah, yeah.
And what happened is that I was like, hold on, I keep telling my patients to meditate. I should do that. So I started
Oh, wow.
meditating. I had no more pain. And I was just like, and it's so I
Really?
come out of the meditation and I was like, what just happened? This really worked. And I was like, of course I knew it worked because I used it.
Yes.
but I never used it for pain. I had used it
Mhm.
for other reasons, for
And
like
acute
stress.
pain, not just like,
It
"Oh, I'm
was,
having my
yeah,
daily chronic pain," or "I have an
yeah.
episode or a
It was
flare," but like
unbelievable, unbelievable.
hmm,
No more pain, and I was just like, wow. I mean,
wow.
yes, I know I tell my patients and all this, but like when you experience it, you're like, no, I like all my patients need to know this story because it was unbelievable. And
That's
every
pretty
time I
amazing.
got more pain, I would just go meditate a little bit more,
Mhm.
go meditate a little bit more. And and after a while, I mean, you heal and you don't have the pain, which is
Yeah.
good, right? But I was blown away. I was just like, wow, the thing that I tell my patients where I know that there's science, I just experienced it.
Yes.
So that
That's
was cool.
amazing.
Yeah.
That's amazing. Well,
And the
tell
cat
us
is
a little
black.
more about your own healing journey, if you don't mind. So,
Yeah.
just as a little bit of a spoiler alert, Dr. Amig has had her own health challenges, and I find her story very inspirational to me. Just that she's had some significant health challenges and has had to come to terms with all that, and it's led to some amazing things in her own life. So, I'd just love for you to share your journey.
Yeah, thank you so much. And I'm so, I was blown away when all of this happened to me. At that time, like I was like, I need to share this as well, right? The same thing that the cat biting and scratching me,
Hmm.
but this is almost just, probably even for me, it changed my life, right? So I did two training, right? Like one in France, one in the US. I did a lot of scientific
Hmm.
research because I was going into research like tertiary centers and
Hmm.
academic centers and so on. I have many publications. So I'm very evidence based medicine. But then I got diagnosed with stage 4 breast cancer, metastatic to the liver, metastatic to the bone.
Hmm.
And I got this encounter with someone that had nothing to do with Western medicine. And I don't know really why I went there, but I was just like, I need everything on my side. And
Yeah.
I met this person, and
Yeah.
she's a naturopath in France because I was
Mhm.
in France for like 2, 3 days while I was receiving the diagnosis,
Okay.
which, it was completely random. And this naturopath tells me, you don't see the disease as your enemy, see it as a friend.
Mm.
Yeah, I mean, I'm like,
That
for
doesn't
people
sound
who are
very
just
friendly to me, but okay. Yeah.
exactly. Well, so this is the thing is that I was like, hold on, I've been looking at diseases as enemy my whole life. Like
Yeah.
it's something that I need to get rid of, right? What
Mhm.
about this is part of me? It has my DNA, it's my
Mm.
body. And what
Yep.
if, because she's like, like see it as a friend that's coming here to teach you something,
Yes.
and once
Oh,
you
wow.
learn what it has taught you, it can live like any good friend.
Wow.
Many times during my cancer journey, I was like, I've learned a lot. Please, you can go now,
Yeah.
but the thing that was the shift, the mind shift here, is that
Yes.
instead of using this energy to fight and be frustrated with why me, like, I had just turned
Yeah.
40. I had just finished my studying, like 16 years of studying, right? Like I was, I had not
Right.
just, but like finally I had like an attending's life and all this. Kids, they were growing, and then I was like, what? and and instead of being like, why me? Instead of being like, I need to get rid of this, I was like, okay,
Yes.
what can I learn? What can I
Wow.
learn? And what can what is my body teaching me, right? So I came to term with the fact that I had this condition, and I
Mhm.
saw it as something positive, not negative, not,
Yes.
I mean, like the
And
shifting
not
in
even neutral, but like positive, right? Like
positive.
I could imagine thinking it's neutral. Okay, I'm not going to
Yeah,
judge this thing. It's just a
no,
thing. I
positive.
get that, but to really think of it positive, whew, I'm going to need a minute.
Yeah. Well, I mean, even I, even I, well, I mean, I think that there's a couple of things.
Mhm.
One, I was in a place where I was like, wow, it's stage 4. It's aggressive,
Oh yeah.
like it was very aggressive. Like it was big and it went
Right.
fast, right? Like it was fast. And I was like, like, I need to change something in my life,
Hmm.
probably more than just one thing, and I'm going to learn everything there is to learn from this condition,
Yeah.
and at the same time I'm going to do everything that's in my power to get back to the health, right? But that means not just get back to where I was, but like even better. And
Yeah.
so I mean, I don't think I knew exactly what I was doing, but the one thing that I was doing very clearly was I need to figure out what I can learn from the situation.
Hmm.
And what it did is that instead of focusing on the pain, right, like the pain point, which is the cancer, it
Hmm.
allowed me to figure out, like, okay, what can I learn? What do I want in my life? What is this teaching me? What is this bringing me?
Hmm.
And it's funny because it's been 4 years now,
Wow.
and yeah, exactly 4 years. In like a week, it will be 4 years that I had the diagnosis, but I probably had this cancer right, like 4 years ago.
Sure.
And I look back at that time, and it's not negative at all. It's not. It's like
Wow.
this sort of butterfly coming out of a cocoon and just
Yeah.
changing.
It's change. Yeah, for sure.
And I use this for my patients now. I always tell my patients, especially those who are having more difficulties getting into remission, I always tell them, this is a homework for you, but you've got to like sit down, meditate 10 minutes if you want, and have a piece of paper, like have your journal in front of you, and just ask this question: what is this bringing me? What am I learning today from
What am I
this?
learning today? Yeah, I like
Yeah.
it.
And I have goosebumps here because I've had so many of my patients have a change, right? Like have a change of how they looked at their disease. And so suddenly their treatment were working. Suddenly they were not allergic to their treatment. And suddenly they
Mhm.
could let go of whatever they had. And I'm telling this of severe disease and less
Yeah.
severe disease, right? And
Yeah.
so I'm not saying that that's odd. I mean, like Western medicine is why I'm here.
Yeah.
I,
We
you know, I
do
could not
these
have
things,
done,
I
I
think.
could not
Yeah.
have been here with, I mean, maybe I could, but like honestly, I feel like I'm very grateful for Western medicine.
Yeah. Because
Um,
you took chemotherapy and you took
Absolutely.
whatever treatments your
Yeah.
Western doctors were recommending, it sounds
Yes.
like, but you
Yes.
added to it.
Exactly. Exactly. Yeah. I did everything. And, but the way I saw it was that I was making sure that I was in the best position, disposition
Hmm.
to help my body heal. And
Hmm.
so I remember like going chemo and going to the chemo and being like, I need you to focus on the cancer cells, and the cancer cells need to leave because that is not in my higher good, like higher power, whatever it is
Hmm.
that we say, but really like just yeah, let's help get this away. And it was always like a very positive. And I'm if you know me, like I'm a very type A personality. I'm very feisty.
Yes.
I
Yes.
used to
Yes.
do like
Yeah. We can tell you're
boxing.
feisty. Yeah.
Yeah. So it's not like when you see how I heal myself, it's like completely antinomic. Right? It's really funny, but it was just so good. It really helped me. This meditation, I kept listening to Louise Hay. I don't know if anyone wants to listen to Louise Hay, and some people may say that it's a little woo woo, and she talks about affirmations a lot, but it helped me, and I think it helps a lot of my patients. And I'm like, okay, there's no study on Louise Hay, but we should probably do a study on Louise Hay.
Hmm.
But affirmations are good if you keep being in fear and being like, oh, I need to keep like you know I keep having pain, but rather be, no, every day I get better. Every day I'm doing better. And I have a doctor that's like caring for me. And so I have a good team with me. And so all of those words, they are, powerful. Um, but yeah, no, it helped me so much, and it's helping my patients. And I kind of want to share this with everyone because to me, it changed my way of doing medicine. Instead of fighting, I was like, okay, let's try to understand, and let's just to support your body. We're supporting your body to heal. So yeah.
I'm looking up this name, Louise Hay. There it is.
Louise
Yeah.
Hay.
Yeah.
Louise Hay. Louise, and Hay is Hay.
Hay.
She's
Very
past that. Like she died super late, but she
good.
had herself a cancer, healed her own cancer, which again, as
I
a
love that.
scientist, I'm always like, what? I know it's possible. We know it
Yeah.
because I think every minute there's like one cancer cell that you remove from your body.
Hmm.
But still, it's always
Yeah.
fascinating to see things that you think maybe a little woo woo, right? I think that before we thought meditation was woo woo, and
Right.
now everyone is talking about meditation. But I think it's
Yes.
important for our patients to know that there's data behind all of this, right? So to kind of conclude my own personal journey, know
Yes.
that I was doing all of this. So I was doing meditation, visualization.
Hmm.
I was doing a lot of visualization actually. Visualize myself healthy, visualize
Hmm.
myself healthy. That was really important. So visualize myself without pain and so on. And then I did some journaling, which I wasn't doing before, but it allowed me to put my stress on paper and come with solutions, which was very powerful. And exercised and then changed the diet. So I did have a very good diet at that time. I felt really good then.
Yeah, I was
I
going to
know
ask
how,
what kind of special diet have you used as
yeah,
part
it's
of
a
your
diet.
journey? I'm interested in that.
It's what I think people call the anti-inflammatory diet.
Okay.
No sugar, no. So I had no sugar and no dairy. And the reason for it, for the sugar, is that cancer cells are very simple. And
Okay.
so they like sugar very much, right? Like, at least
Hmm.
theoretically, it made sense. I was like, okay, it makes sense. I'll do
Yeah.
that. And then dairy is, has full of growth hormone because you want to, when you
Yes.
have dairy, it's to make your baby grow. And I was like, yeah, I may not want to have this. Well, I'm French, right? Like a French person. Like
Yeah.
I love
Butter
milk.
and delicious
Uh-huh. Yeah.
dairy is
So,
part of, yeah.
yeah. So I stopped dairy, I stopped this, and then I started eating a lot more veggies
Hmm.
and no more meat. But I'm not a big meat person anyway, but
Yeah.
I would just eat like a little bit of fish and a little bit of, and the reason I really did this diet is that three different people told me about the diet and they were completely unrelated. And so I was like, okay,
Hmm.
three people that have nothing to do are telling me about a diet. I need to listen. So I tried and I felt so
Okay.
good. And I was like, hold on, this is not the chemo making me feel that good. So like
Yeah. Right. Right.
something is making me feel good. And it's probably the diet. So the diet, the exercise, the meditation, I felt really good. And I was doing also a little bit of energy healing, which, and so, again, I did some Qigong, which has energy healing.
Hmm.
It's completely crazy when you hear about it. It's like sort of Reiki.
Hmm.
But here's the thing. So when I was doing it, I had like this fight between my left brain and my right brain.
Hmm.
So my heart and my, analytic brain. And I kept thinking, this is BS. Like this is not evidence-based medicine. But my heart was like, well, but it's working. Look at where you are. It's like you're feeling
Yeah.
good. And so I kept doing it because I was like, okay, well, I'm going to support my heart, right?
Yeah.
And once I was, done and in remission, I started looking at the studies of all of those things. And I was like, wow, there's studies that are backing those things up one after the other. There's meta-analysis, which is like basically a big study of all of those small studies for your
Hmm.
auditors, right? And you're like, wow, why is it that I'd never learned about this?
Hmm.
And I was just like, wow, yeah, I'm going to tell my patients about visualization because there are studies behind meditation. There's a ton of studies behind that. And
Hmm.
there's starting to be studies on Qigong, the movement Qigong.
Yes. I
But
put that
still,
in the chat here too. That QI gong, qigong. Yeah.
yeah, Qigong, yeah. So, yeah. So it's super, super powerful to me because I went from being very skeptical about those things to using them to actually teaching them. And
Wow.
it's super powerful to empower our patients like that because
Yes.
it's not just about medicine. It's not just about the injection you may give, but it's about like, hey, there's a healing effect here that's between you and I, and let's use that.
Mhm. And
On
you've
top.
seen, I guess I'd be interested to know, and I think this is true, but you've obviously used this for your own healing, these techniques. Um, can you share a time that you were treating a patient with a rheumatic disease that you were able to implement? I mean, I'd say some of these things
Yeah.
are lifestyle changes, right?
Oh yeah. Oh
These
yeah.
types of lifestyle changes that can make a real difference for a person
Yeah.
with, disease or pain or function or all of the above.
I have so many of those, right? So
Yeah, I bet.
between figure out what this is bringing to you,
Hmm.
and those are usually I spend really a lot of time on those patients who, after like free trials of different treatment, like we're not going anywhere. There's either like some side effect or something, and I'm like, okay, like this is you need to do this homework. Like you really need to do this homework.
Hmm.
So I've seen this, and it's funny. Then I would tell all my patient about all of the things, right? Like visualization, meditation, affirmation, exercise, and diet. And what I found is that everyone has sort of their favorite. And
Yeah.
so I had a patient with severe interstitial lung disease, so lung problem. And okay, so this is a very interesting story. So she's Medicare, so over 65. And for some reason, I wanted to blast her with immunosuppression because I usually put off the fire with a lot of immunosuppression and then I back off.
Hmm.
And she was severe and the risk factor really high to get even more severe. So I was
Hmm.
like, well, not one, but you're going to get 3 immunosuppressive agents. Okay, and then 3 months passed, and basically we didn't realize that the insurance had denied everything, like which is
Hmm.
crazy. And it yeah, and the patient I think didn't realize that she needed to tell us that it had been denied anyway. So issue with the previous institution, but uh, I'm realizing this, and I'm about to open the door, and I'm like, I don't know how she's gonna be. I feel awful. She missed 3 months, right? But I had told her, look, even while you're waiting on this prioritization and all this, just start doing those things. So
Hmm.
I opened the door, and she was better than I had seen her before. And I'm like, wait, did you get your treatment? She's like, no, none, because the medication I haven't. And I'm like, what did you do? She's like, I did what you told me to do.
Wow.
And I was like, what? She's like, yes, this was crazy. She had had diarrhea forever, even before, this whole lung disease.
Uh-huh.
And she changed her diet and started meditating. And mostly she kept saying, it's the diet. Thanks to this new diet, I don't even have diarrhea. I feel better than I've ever felt in my life right now. And I was
Wow.
like, okay, this is crazy.
Wow.
Yeah, that's just one example. I have so many. Like I've had some patients where severe vasculitis do meditation and visualization, and a lot of visualization in the case of this patient.
Uh-huh.
And yeah, I mean, she had like a foot drop. She doesn't have a foot drop anymore. And so you're like, yeah, I mean, yes, there is the immunosuppression that I give. There's no question that my medicines work really well. That's why I'm a rheumatologist. But all of those things are super, super powerful because, when you look at data, like even if we call this placebo, it's like 30%. And so
Hmm.
to me, it's like, hey, why would you not take a
Yeah,
placebo effect if I can give you one that has no side effect and is free?
that's right.
And I don't think they are placebo effect. Actually, at this point, I think that they are
Hmm.
super effective and they are not placebo effect. But even if you're like a dead scientist like I was before, and are like, okay, the randomized control trial is not double blind or whatever.
Hmm.
I think, yeah, take the placebo effect.
I
That's
love
the
it.
bottom line.
Yeah, no, I
Yeah.
think that's totally right. We don't generally prescribe placebos as part of treatment, but it's incorrect to think that they aren't real and don't have effects, because they do, and they're big effects. It's hard
Mhm.
to do better than placebo, actually. It,
Yes, it's
it can be
hard.
challenging for a new
That's
drug or a new
very
intervention.
Yeah, that's very, very valid, like very well put, because it is true. It is hard to prove that. Yeah, it is very hard.
Hmm.
It's funny. Just a side note: drug companies, are trying to get rid of the patients who respond to placebo because they are trying to show that it's easy. Like, they want to make it easier for them to show that their drugs are working, and
Oh, isn't that
so
interesting?
yeah, it's
Yeah,
it's really interesting. They're trying to get rid, and so to do some
yeah.
studies just before to see who is placebo, who is a responder to placebo,
Hmm.
and then get rid of those patients so that they have only the patients who don't respond to placebo.
Wow.
I know
Yeah,
it's interesting.
in the pain medicine world, that is a thing, and for certain injections, particularly, that we do, there's a group that are the placebo responders, and you can't look at someone and know in advance, but it is a real thing that there are people that will just get the beneficial effect because they did something, and whatever
Yeah,
it was.
yeah,
So
yeah,
why not do things that are low risk and free and all that?
yeah.
Yeah, that's awesome. Well, and tell us a little about your practice. So for those of you that are in Colorado, Dr. Amigues, I believe, is in Denver. Is that right?
Yeah, that's right. Yes.
Do you see patients all in person, or do you see patients virtually also?
So I do both. So it's like sort of the first plan of this big center of hope that I want to create. I'm putting it out there because I really want this to happen.
Yes, we're going to claim it. Yeah.
Exactly. Like with the idea that center of hope, that there will be like all of those modalities that I'm talking, like meditation,
Mhm.
acupuncture, and so on.
Yes.
But for now, the first part, the first step is the direct care rheumatology practice. So,
Yes.
direct relationship with the patient so that I have enough time and as much time as I need to take care of my patients holistically, like fully. And so we call the practice unabridged MD for non-edited version of the patient and non-edited version of me and of
Yeah.
the
Yeah.
like hopefully more practitioner will come, but just with this idea that you don't have to be just in a box and you can just be you,
Take the
right?
time
Like
that you need. Yeah.
being us. And so unabridged MD, I'm in Denver, Colorado physically, but I also do telehealth.
Hmm.
And actually, I'm going to start accepting patients via telehealth for Wisconsin and Michigan. And I'm going to create more like around because there's a need in the surrounding state. There's
Yes.
not a lot of rheumatologists. So
Yes.
stay put if you're interested. But yeah, we are open as of a month, almost 2 months ago, and it's going very well. Like patients love it. I love
Yeah.
it.
Wonderful.
It's good. Yeah.
Wonderful. Yeah, no, I think it's so important, and it is so challenging in the current healthcare environment for a physician to be able to take the time
Hmm.
to spend with patients, and so that's great that you're finding a way to do it. And in your practice, if a patient needed a specialty medication or an infusion, these are things that might take your time also to get them approved or get them to the patient. I mean, that's still part of your work.
Yeah, absolutely. Yeah. So I still order. I mean, I'm still a doc, so I still
Yeah,
order. No, but that's such a good question. I didn't realize that patients would be wondering about that. But yes, I still order.
yeah.
I still order labs. I still order. I do my own ultrasound, which is great because then
Mhm.
they like before that was like you can only do 4 joints, and I'm like, but why? If like I want to do more,
Yes.
So yeah, I can do as many ultrasound that I want. I can do injections and yeah, infusion. We do prior auth, and I think it's actually nice because we get to explain to the patient every single step on the way,
Hmm.
the prior authorization, so that they understand. Because the prior authorization, the insurance is such a pain,
Oh yeah.
and so yeah, it has to change somehow. So this is
Yes,
the
I
first
know.
step.
Yeah. Well, I think that I think I'll work on wrapping us up, but I think this has been such a valuable conversation, and I just find your story so personally inspiring, and I'm just thrilled that you're here to share your journey with patients and have people understand that, as a medical doctor, how you've been able to, beat some of your own challenges and now help other people with theirs. I think it's just awesome.
Yeah. Yeah, thank you so much for having me. It's so good, and I love what you do. So I mean, we work together, right?
Oh yeah,
PMI.
yeah. It takes a team, right? That's right. Yeah,
Yes,
we have a lot of rheumatology
yes,
consultations that get sent because we just need for that other set of eyes with a particular skill set to
yeah,
understand and look and diagnose and treat, confirm the diagnoses we think we have, or find new ones depending on the
yeah.
situation.
So
Yeah.
yeah,
Well, thank
thank
you so
you.
much. I've got Dr. Amigues links in the chat here. Please find her at Unabridged MD, and you have a podcast, I think. Is that right?
I do. Yes, I
What is
do. We
your
should have that.
podcast called?
Unabridged MD.
Unabridged MD. Well, see, that's a good name. That you can just call it all that. Excellent.
Yeah.
You'll find her at Unabridged MD on all of your favorite platforms: Instagram, Facebook, podcasts. Very good. Thank you so much.
Thank you so
Okay.
much.
Take
Take
care.
care. Bye bye.